Deprescribing is the process of reducing or stopping unnecessary medication.
Deprescribing is identifying the medication that can potentially cause more harm than good.
If we look at sleeping tablets, they can increase the risk of falls, increase the risk of car crashes.
It's the process of discussing this with the patient who's taking that medication and exposing the benefits and the risks.
Giving prescriptions, we know well, but deprescribing takes a new skill set.
The Canadian Deprescribing Network is a group of healthcare professionals and researchers and policy and decision makers from across Canada.
A number of us said there is a pressing need to do something about all the medications that everyone's taking. We got together, we brainstormed, we created a strategic plan, and then we went with it. The goals of CADeN are to reduce unnecessary prescriptions by 50% and render accessible non-pharmacologic therapies so you don't have to use medications.
We have recognized that we need to deal not only with individuals who are being prescribed medications, but we also need to recognize the needs of prescribers as we do the work that we do.
I think that as physicians, we learn to prescribe, and we hardly ever have any opportunities to reflect on when are the indications to reduce a medication or taper it or terminate that prescription.
Working with healthcare providers to increase the awareness that these drugs are maybe not as appropriate as we used to think they are, but also provide awareness of what the alternatives are that we can use, I think is something really important. The other side of that is across the desk from the healthcare provider, and that's the patient.
Canadians might be surprised to know that as many as 1 in 3 older adults uses prescriptions that are known to pose more risks than benefits in comparison to safer alternatives.
Le patient est vraiment au centre de la conversation, il participe activement. C'est lui qui est l'expert sur sa propre santé. C'est lui qui sait ce qu'il ressent et qui doit communiquer ses symptômes.
We need to work with patients, with their families, their carers, their children, and really explain that inappropriate medicines exist. And it's part of their role to actually ask their physician or their pharmacist or their nurse, is there something else I can do to make a safer choice or make these side effects less likely to occur?
We went through each pill one by one and concluded that there was at least one of the 6 that was unnecessary.
Je prenais un médicament pour dormir, puis là je l'ai cancellé, puis ça me dérange pas du tout, je dors pareil.
Côté mémoire ou Alzheimer, c'était pas bon en fin de compte de les prendre. Puis disons, non, je ne veux pas arriver là. En vieillissant, on a des petites pertes de mémoire, mais ça revient. Fait que non, je me sens à l'aise de les arrêter, puis on va de l'avant.
Our secret is involving the policymakers as well as the healthcare providers and the general public. Policy is really the lever that dictates what's acceptable and not, and what the standard is in society.
Change policy, CADeN's working in a couple of different avenues. We're looking at policy both nationally within Canada and policy around the world to see what has worked. We're working with a couple of different organisations across Canada, several different universities, and CADeN is involved as well, so that we can analyse this data and say what will work in the Canadian setting and then put policy recommendations forward.
Those of us in the policy environment concerning pharmaceuticals in Canada are encouraging governments to invest significantly in a coordinated national strategy around prescribing appropriateness. If Canada could reduce the cost of potentially inappropriate prescribing by just 10% through a policy that encouraged better use of medicines, we would return many times our investment in appropriate use back to Canadian taxpayers.
The advantages of a network cannot be stated to their full extent. Not only do you have the hands-on partnerships, the sharing of processes and tools and resources and contacts, but you have the shared learning and the transfer of knowledge that occurs.
By collaborating as a group, we reduce the risk of duplicating our efforts, and we maximize the chances for widespread success of our various initiatives.
It's getting people from different backgrounds and different perspectives to work together to find solutions that will be scalable and that will last in time.
We can all make a difference by discussing deprescribing and its positive changes with family, friends, care providers, physicians, advocacy groups we belong to, and the provincial and federal politicians which represent us.
C'est super important justement de conscientiser le public sur ces effets potentiels néfastes des médicaments. Je pense justement que l'éducation, autant chez les professionnels, mais beaucoup, je pense, chez le patient, est vraiment la clé dans le succès dans la saine gestion de la médication.
I'm a strong believer that if we get patients in the loop and getting patients asking questions, that's going to be a very, very strong lever to have the healthcare system change.